Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. This summer is a great time to travel, but it is also the midst of the 100 deadliest days for teen drivers.
On the highways, there's much more volume of traffic. The people that are driving are potentially less knowledgeable about where they are because they're on vacation. They're driving slower. Some are driving distracted looking at maps and all the other kind of things. We've got to be serious about minimizing the risks. You know, you can't eliminate them all, but there are some very definite steps we can do.
Medical and transportation officials don't refer to them as accidents. They call them motor vehicle crashes because they are predictable events.
Motor vehicle crashes, as we call them now, or injury events, are very predictable because they almost always entail excessive speed, impaired driving, the kind of distracted driving that we see with texting and driving.
When it comes to saving lives, the #1 thing is seatbelts.
Seatbelts is such a simple thing that will really take about 90% of the sting out of an injury event because they'll really prevent the head injury piece.
Similar to when a pilot prepares for a flight, Dr. Hirsch recommends all drivers have a checklist.
If people just took a minute and be mindful of where they're going and what their purpose of the drive is, we can make a big impact in this.
From car seats to driving simulators, UMass Memorial embraces a cradle-to-college approach.
The adolescent brain is just not quite mature enough to make the right kind of executive decisions yet. And we've got to support that brain, and we also want to protect that brain.